Support for The Middle comes from you and from the Pritzker Military Museum and Library, preserving the story of the citizen soldier and connecting military history to the decisions citizens and leaders face today. Welcome to The Middle. I'm Jeremy Hobson, along with our DJ Tolliver. And, Tolliver, prices have been going up on a lot of things in recent months. The gas prices are up, in part because of the war with Iran. Prices of many items have risen because of the tariffs. And for some reason, the little button for the tip at restaurants and bars now goes up to like 40%, which I don't understand.
That's like a home loan at some of these restaurants.
It's like, what's the goal here? Are we trying to go to 100%? Is that what the end goal is for the tip?
Yeah.
Anyway, the other thing that has really skyrocketed in price for many Americans this year is health insurance. Back at the beginning of the year, Republicans in Congress decided not to extend subsidies for Obamacare plans, which sent premiums for those plans up by an average of 20%, and in some cases, much more than that. People with private insurance plans are also seeing their premiums jump by 6 to 7% this year, leading many Americans to drop out of the insurance world altogether and just chance it. So this hour, we want to know how your healthcare is working for you, whether you are on a private plan or a government subsidized plan, or if you're uninsured. You can call us at 844-4MIDDLE. That's 844-464-3353. Or you can write to us at listentothemiddle.com, and we will get to your calls in just a moment. But first, last week we asked if humans should really be trying to live in space. Here are some of the voicemails that came in.
My name is Chris from Colorado. I think we absolutely should be an interplanetary species. There will come a time in our species' future where we will have to leave this planet. If we tie our hands now, we will be doing a disservice to the future of our species.
Hi, this is Zan. I'm calling from Charleston, South Carolina. I absolutely do not think that man should go, or woman, to live on another planet. At the current moment, we cannot take care of this planet, and it doesn't seem logical to go and do that elsewhere.
Hi, my name is Todd, calling from Crete, Illinois. I think space exploration by man is a valuable thing to do, but I think we need to figure out a way to learn to not just continue to expand and leave a wasteland in our trail.
Well, thanks to everyone who called in, and a reminder, you can hear that full show and more of your voicemails on our podcast extra, The Follow-Up. Just subscribe to The Middle wherever you get your podcasts. So now to our topic this hour. How is your healthcare working for you? Tolliver, how can people reach us?
You can call us at 844-4MIDDLE. That's 844-464-3353. Or you can write to us at listentothemiddle.com or comment on our live stream on YouTube.
And by the way, I do want to hear from you, even if you are satisfied with your health coverage or if you have no health insurance at all. Joining us this hour, California Congressman Kevin Kiley, former Republican, now an independent. Congressman, great to have you back on the show.
Thanks for having me. Appreciate it.
And Julie Rovner is with us as well, Chief Washington Correspondent at KFF Health News. Julie, welcome back.
Nice to be here.
So we were planning to do this show, Julie, back in January after the Obamacare subsidies expired. Then it got pushed because of Venezuela, because of Minnesota, because of Iran. But this was a big thing that happened in America in healthcare. What has been the effect of the end of the subsidies for Obamacare plans on healthcare in America?
Well, I would suggest that it's still a big thing, even though, the news media has been following other stories. As somebody who follows healthcare pretty much exclusively, we just saw a Gallup poll this week that had people worried about the cost of healthcare. It was number one of 15 different domestic potential problems that they are worried about. So we saw a KFF poll a couple of weeks ago that also found the cost of healthcare to be people's number one issue. I think this is rising for a lot of people. As you mentioned, the people who got hit the hardest and who are having the biggest sticker shock are the people who lost their subsidies under the Affordable Care Act. But premiums are going up for everyone. Cost of healthcare are going up in general, so people are paying more in out of pocket. And, as people are trying to juggle with the rising costs of mortgages, the rising cost of groceries, the rising cost of gasoline, it's a real problem for lots and lots and lots of people, even if they have decent insurance.
So, Congressman, as we mentioned, you switched parties to independent. You were a Republican at the end of last year, and you were in favor of extending the subsidies. What have you heard about the consequences of them not being extended?
Well, people's costs are really going up, and we're talking about millions of Americans, independent contractors, small business owners and their employees, early retirees who have seen a sharp and sudden increase in healthcare costs, which I think is going to ultimately spread to the rest of the employer market as well, potentially, because people are having to drop out, and so you could see a cost increase across the board. But in my state in California, we've seen that costs have continued to go up while life expectancy and other health outcomes go down. People have a hard time even seeing a doctor. A lot of people report that they're delaying care because of issues related to cost. So, the poll result you just cited, that Julie cited, about this being a top concern for people, I think that is absolutely true. We're at a time where people are gravely concerned about the cost of living. And, when it comes to the cost of living overall, healthcare is a huge part of the problem.
Do you think, Congressman, that the short-term response is still to extend the subsidies, or what should it be? What should happen?
Well, sure, we could do that right now. And I think that, I've introduced a bill, the Fix-It Act, which was a bipartisan bill that I authored with Sam Liccardo from San Jose. And we had a number of co-sponsors on the Democrat and Republican side. There were a couple other compromise proposals that reformed the program while providing a temporary extension that had significant bipartisan support that I think would have passed overwhelmingly in the House had they gotten a vote. But none of these compromise measures did, unfortunately, for various political reasons. So yes, that could be done right now. But I don't think we can, pretend that that's going to solve the overall issues related to healthcare cost and accessibility in this country. That's a much deeper problem. But at least a temporary extension of those subsidies would spare folks some pain in the meantime.
Julie, when you look at the big picture, you've obviously got older Americans who are on Medicare. The poorest Americans are on Medicaid, but about 60% have their health care through their employer. What kind of an effect has all of this had on that majority of people, at least working age people, who have private insurance?
Well, I think, we should point out, you talked at one point about people who have, government subsidized insurance. Everybody has government subsidized insurance. If you have employer health insurance, it is subsidized by the government to the tune of a double tax exemption. Your employer does not pay taxes on on what they provide to you, and you do not pay taxes on the value of what your employer provides to you. So everybody gets help from the government. In fact, when the Affordable Care Act passed, that filled in the last gap. It was only people who bought their own health insurance, as the Congressman pointed out, people, independent contractors, people who own their own small businesses, people who worked for a job that didn't offer health insurance and had to buy their own coverage. Those were the only people who weren't getting subsidies. So now the only people who are not getting subsidies are people who are too wealthy to get the Obamacare subsidies, which expired at the end of last year. But one of the things that we see when you see more people without insurance, and we are seeing people drop their Affordable Care Act insurance because they can't afford it or drop down to a lower level of insurance, is that hospitals and doctors and other healthcare providers have trouble keeping their doors open, making their ends meet. And so healthcare becomes less available to people even who do have insurance. So it is a problem. We're seeing it mostly in rural areas, but not exclusively. So don't think that, just because you have employer insurance and it's okay, that you're going to be fine.
Right.
This, ripples across the entire, healthcare infrastructure of the country.
Well, and Congressman, you've got a lot of rural areas in your district, a lot of constituents in those situations. Aside from the insurance piece of this, what does it mean for somebody's health care to work for them if the hospitals, the doctors can't stay in business or can't provide the service?
Yeah, that's a great point, and this has been a huge issue for our hospitals our critical access hospitals in California. We've actually had some that have closed, and part of the problem, actually a big part of the problem, is we just have very low reimbursement rates for things like Medicaid, or we call it Medi-Cal in California. So a lot of doctors don't even, take Medi-Cal patients. And so even if you're on the program and you're insured, a lot of times you have a really hard time getting an appointment. And then for these critical access hospitals, if their payer mix, turns upside down or is not the right way or doesn't have enough private insurance, then it just becomes really hard for them to keep their doors open. So it is a really big problem. I think that there's a lot we could do to support rural healthcare, things like expanding telehealth, for example, in areas where you don't have immediate access to a doctor or a specialist could be a start. But yeah, a lot of these hospitals are really struggling.
Julie, who do you talk to that is really happy with the way that our healthcare system is going right now? I'm sure there's somebody that's saying, oh, well, I mean, people talk about the fact that, all the innovation happens in the United States and we've got these incredible treatments for things like cancer and stuff like that. But who do you talk to that's saying things are going well?
People in other countries. I've actually been to Europe twice in the last 6 months. I was in France. People there were real happy. I was in England this spring, and people were pretty happy there. I mean, England's health system has its own problems, but when you go to another country and tell them that you're from the United States, they look at you and sort of shake their head in sorrow. Things are not. I don't think anybody is particularly happy, even the people who are making lots of money from the health system as it is. I know the people who work in the health system are unhappy with the way it's working. The people who are trying to navigate the health system, even with good insurance. I think this is very different from before the Affordable Care Act was passed. This was mostly an issue of haves and have-nots, and there was a lot of political back and forth to make sure we didn't bother the haves, that people who were okay with their health
keep
insurance
your doctor.
Exactly.
Right.
You can, if you like your health insurance, you can keep it.
Right.
I don't think anybody's very happy right now. I think that's a big difference. I think even people who might be able to afford insurance have so much trouble just navigating the system that everybody's ready to sort of figure out something better.
Well, Tolliver, in January, President Trump offered one solution after the subsidies expired.
Yeah, and surprise, you'll never guess, it's called the Great Healthcare Plan. Here's a clip from a White House video about it.
Our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win.
That plan, by the way, hasn't gone anywhere since it was unveiled, and there are big questions about what it would mean for people with pre-existing conditions, which is to say potentially half of all non-elderly Americans. We'll be back with your calls in a moment on The Middle. This is The Middle. I'm Jeremy Hobson. If you're just tuning in, The Middle is a national call-in show. We're focused on elevating voices from the middle, geographically, politically, philosophically, or maybe you just want to meet in the middle. This hour, we're asking if your healthcare is working for you. Tolliver, the number again, please.
It's 8444-MIDDLE. That's 844-464-3353. You can also write to us at listentothemiddle.com or on YouTube.
I'm joined by California Congressman Kevin Kiley, an independent, and KFF Health News Chief Washington Correspondent Julie Rovner. Before we get to the phones, Congressman, we heard there from President Trump. What do you think of that plan to take the money from the subsidies and just give it to people to use in the insurance market?
Well, I don't know that that is practical in the short term in terms of stopping the cost increases that people are seeing because of the expiration of the subsidies. I do think that health savings accounts have merit when you have a couple conditions in place, when you have competition in the healthcare market and you have transparency as to price, and then they tend to work best when it comes to sort of routine expenses that most people just tend to have in the course of their daily lives.
In addition to having health insurance.
Right. So like Singapore, for example, they have a very robust health savings account type system, but then they also have an insurance system for catastrophic conditions or things that, the really costly items. So I think there is a lot of merit to the idea, giving people more control over their healthcare expenses, but it has to be done in a way where they can actually shop around, compare prices, and we have that transparency.
Julie, what do you think? What would it mean to take money out of subsidies and give it directly to people to find insurance in the private marketplace?
Well, it wouldn't be not giving it to the big insurance companies. It would just be not the federal government giving it directly to the big insurance companies. I mean, I think the congressman is right. There's been a long debate about health savings accounts, which we've now had for 30 some years. And, some people who have them tend to like them. It works best, as he said, for shoppable, predictable services. If you need, if your knee's bothering you and you need an MRI, and you don't need it tomorrow and you can shop around, it can work for that. Although we've even had trouble getting transparency of prices for things that we call shoppable services. Hospitals and insurers who've been required to provide this price transparency now for some years keep finding ways around it. hospitals will say, here's our charge master. You can pick through, tens
Right.
of thousands of codes to see how much this might cost. So even people who try to shop for healthcare have trouble doing it.
Yeah. I mean, every time I've ever run into a problem with an insurance company, I'm like, I literally said to somebody, I'm glad that I'm not a senior citizen because I would never be able to figure this out. And and nothing against senior citizens, but like it was very, very challenging to like get through all the, bureaucracy to try to reach somebody and ask them a question. Let's go to the phones. Mary is in Manhattan, Illinois. Mary, is your healthcare working for you?
It is not, actually. I tried signing up for a different plan through like the marketplace because the rates went up and there was a mix-up, so now I'm uninsured. I don't know where to go to get care, and I can't get care at the moment. I'm going to try a county clinic, and hopefully I can get a job that comes with insurance.
But right now you're uninsured. Are you operating differently in your life just to make sure you don't, fall or anything like that?
I am, and I'm concerned. And I do have some things that, need attention, but I just can't do anything about that right now.
Just briefly, what would you like to have happen? Mary.
I would like to have a system in place that if you lose your insurance or you don't sign up in that tiny window that you can, it'd be nice. And so I would like to have a system where we can get health care.
Yeah. Mary, thank you very much for that. Congressman, I'm sure you've heard people just like Mary, your constituents who are facing the same situation. What do you tell people who they've lost their insurance and then all of a sudden they're uninsured?
Yeah, I mean, I tell them I completely understand their frustration and outrage that this would be allowed to happen. I mean, it sounds to me kind of like she was someone who was suffering from this cliff, and that she relied on the subsidies to participate in the individual market, and then suddenly they went up, and this was a big shock to people, and suddenly they're forced to pay hundreds of dollars more, maybe thousands more, and they just can't afford it, and so they have no choice but to go without insurance. And then, of course, when we have a larger uninsured population, that's not only very harmful, and for folks like Mary, I think it was, but it's a huge problem for the whole system. So that's yet another reason why, still to this day, here sitting in April 2nd, we could come up with a solution here. We could make people whole. We could extend open enrollment so that folks like her could re-enroll.
What do your fellow Republicans say to you? I mean, you're an independent, but what do your former fellow Republicans say to you when you say we've got to deal with this?
Well, so some of them were very supportive, actually. We had bipartisan support for bills to extend the subsidies on a temporary basis while, reforming some of the things that had made them very, very costly, and doing it on a short-term basis while we worked on larger solutions to the healthcare problems we have in this country. I think that those who are not in favor of that would say, well, the answer is things like health savings accounts or other reforms to the system, which may have merit in their own right, but are of little consolation to folks like Mary who are suffering the consequences in the here and now.
Let's go to Brenda, who's calling in from Frederick, Wisconsin. Hi, Brenda. What about you? Is your health care working for you?
My health care currently is working for me. I'm newly retired, and I'm on Medicare with a supplement and a Part D. I'm not I don't have any major medical issues. It's working well. It's a mind-boggling system, and I'm a retired healthcare provider. I've watched this pendulum swing a lot. So what I see is people prior to the ACA not being insured at all, getting insurance through the ACA, and then losing subsidies and not being able to afford anything anymore. And then the ripple that you guys are talking about, the ripple effect all the way through, that people just lose the care that they need.
Yeah. Thank you, Brenda, for that call. Julie Rovner, it's interesting that the person here who says that they're happy is on government-funded Medicare.
That's right. And not even Medicare Advantage, not the private Medicare, but with, supplemental, what we call Medigap insurance, and the Part D plan, which covers prescription drugs, things that have been built into Medicare over the years, because, of course, Medicare at the beginning in 1965 was a pretty bare bones package because all health insurance was pretty bare bones. It, was created to look like the basic Blue Cross Blue Shield plan of 1965. And so it has been updated. And I should probably say that of the people in the United States who are pretty happy with their insurance, I would probably put people with Medicare at or near the top. And even that, as she points out, Medicare is hugely complicated. I juggled Medicare for my mom for many years before she died. And, it got more and more complicated. And, of course, as she got older and older and it got more and more difficult for her, it was harder and harder for me.
Yeah, I bet. Let's go to Rose, who's in Houston, Texas. Hi, Rose. What about you? Is your healthcare working for you?
Hi, my healthcare is working well now for me, but earlier I lived in the state of New York at the time a few months ago, and I was in between jobs, and I was looking for state-provided health insurance, and New York has really good coverage. But when I was applying for it, I kept on having errors. I called the state hotline to have help, and nobody knew what to do. I had to find a separate broker. And she said that she was able to get me insurance, but she said that it's been made intentionally more confusing so less people are able to get coverage. I don't know if that's true, but it was definitely my experience.
But now you say you're on private insurance in Texas and it's working out for you?
Yes, so I'm on private insurance with an employer.
Got it. Okay. Rose, thank you for that. Kevin, Kiley, the thing that comes up there is just the confusing nature of all of this. There are the insurance companies, there are the medical providers, the hospitals, and then if in the case of having a government subsidy, that's a part of it too.
Yeah, absolutely. So much confusion, so much bureaucracy, not to mention the effect this has on costs overall when you look at prescription drugs, the role played by PBMs in driving up costs there, for example. But it is just for the patient so difficult and frustrating to navigate. And Julie's right, it can be complicated with Medicare too. One of the things that I actually fought for was in the last budget, they were going to take away this program called SHIP, which actually is there to assist seniors in navigating the various options with Medicare. And that was on the chopping block in the budget, a $25 million program. So I actually led an effort to get that restored, and we did thankfully get it restored. That is a big part of the problem with our entire system, is it just is not very patient friendly.
You mentioned PBMs, by the way, pharmacy benefit managers. Is that something, Congressman, it seems like there's kind of bipartisan support to deal with that issue, which may bring costs down a little bit?
Yeah, there's totally bipartisan support for that. In fact, there was a bill that had bipartisan support that was incorporated into. And I think there is bipartisan support for other things like transparency, like we were talking about with the hospital bills, which there was bipartisan action during two different administrations on that. But Julie's right that you still haven't necessarily seen it play out the way many of us would have hoped, or some of the measures that we can take to get prescription drug prices down. Or, I think that a broader issue here is the idea of preventative healthcare and some of the ways that we can work with policy to enable that, like value-based types of coverage, but also some of the technological opportunities that are going to make that even more powerful in the years ahead here. I think we really need to be thinking right now as policymakers about how we can really take advantage of that in a way that does benefit patients.
Tolliver, what is coming in at listentothemiddle.com?
Yeah, Joanne in Philly says yes and no with regards to her happiness. I have a $0 plan that works perfectly for healthy people. That $0 plan has a deductible that would break me if I ever needed intensive health care. Every year I roll the dice and ask, can I get away with another year of this plan? Sarah in Colorado says, we have Kaiser Permanente, which is insurance and healthcare all in one nonprofit company. We've maintained it since 2006 through my employer and then my husband's, and it is amazing. So there's one. Susan in Denver says, many private medical practices are being taken over by hedge funds, other umbrella companies. Doctors have told me they were forced to do this because dealing with insurance became overwhelming. These companies are no doubt for profit, which then adds to medical costs. What do you have to say about this?
Julie, what do you have to say about that? Hedge funds getting involved, is that a real problem?
It is. It certainly is pervasive. Private equity in general in healthcare, buying up physician practices, buying up hospitals. There have been a lot of stories about private equity funds buying up hospitals and then selling the real estate out from underneath of them. So, to basically take their profits, and then the hospitals can no longer afford the rent because now they don't own the land that they're on anymore. This has been a huge issue, and the FTC was actually looking at this in the Biden administration. legislation. Not so much now, but I know this is something else where there is a lot of bipartisan support for looking at the role of private equity in healthcare. It didn't. I should make it clear that it didn't cause the problem in healthcare, but it's certainly not helping the problems with cost in healthcare.
Yeah. Mike is calling in from Goleta, California. Mike, what about you? Are you happy with your health care? Is it working for you?
No, it works for me, but only because I have to work my butt off. A couple of years ago, I quit my regular job, went into engineering consulting, assuming I would get a plan through ACA. It was affordable back then, maybe $1,200 a month, and now it's $3,600 a month.
Wow.
So I'm a few years from being able to get Medicare, so I need the insurance. I had cancer in the past. I have to do certain upkeep, and occasionally go in for treatments. So yes, it's not really working very well.
What would you like to see happen, Mike?
I would like to see everyone in Congress lose their insurance and have to pay for it themselves.
Okay. Well, let's go to our member of Congress here. What do you say to Mike, Kevin Kiley?
Well, I mean, I think you're onto something. When elected officials have to suffer the consequences of their own inaction, then that tends to be a motive for action. It's like we have this government shutdown going on right now, and I've said, well, rather than the TSA workers and the air traffic controllers not getting paid, maybe the members of Congress couldn't get paid because they're the ones actually causing the problem. But I totally hear you where you're coming from. It's extremely frustrating, I know, for folks like you, and it sounds like maybe you hit the same thing where your costs went up. And frankly, though, we have to look at the fact that this has been a long-standing problem. The cost of healthcare has continued to go up and up and up in this country, and we're not seeing a commensurate increase in the quality of care or access to care. So there are some real fundamental issues that I think we need to solve, but we need to be doing everything we can to make sure that folks like you aren't suffering in the meantime.
Well, and Congressman, what do you say to the person who's maybe screaming at the radio right now going, well, why don't we just have universal health care like these other countries?
Yeah, I mean, I think that there's a lot of other countries that have very different ways of doing that and have a very different history with healthcare and very different traditions. And so, if you talk about universal in the sense that everyone has an option for it, that's different than saying we're going to totally get rid of the private insurance market and everyone's going to lose access to the doctor and the form of care that you have now. So that being said, I think there certainly are things that we can learn from other countries. And I think that applies to both the way that care is provided, the way that insurance is set up, and as well as sort of just to health in general, where in America we have a lot of, the prevalence of chronic disease is a lot higher in a lot of other countries, and you can point to our food supply and the additives and everything else in connection with that. But that is really the fundamental issue above all else when it comes to overall health.
Let's get to another call. Christine is in Chicago. Christine, what about you? Is your healthcare working for you?
Hi. I have Medicare, and for me, it's great because I do have health insurance, but the price of it for me is crazy expensive. So I'm driving, and it's raining right now. But I'm not 65, so I don't have a Medigap plan. I am disabled, so I have to find a subsidy plan, and the price of that is crazy expensive. And also this year, I did not qualify for special help with my prescriptions, and I went from paying less than maybe $500 a year to easily over $3,000.
Wow.
And in a year for myself, this year I'm probably paying over $7,000 for health insurance, and I'm on Medicare.
Yeah.
So when I saw all of the political ads and it said Medicare for all, I kind of was like, I don't know, you guys, is there something a little bit better than that?
Interesting. Just Medicare doesn't sound as great to you as it does maybe to Bernie Sanders. Christine, thank you for that. Julie Rovner, as I hear these numbers, $3,000, $7,000 a year, the previous caller said $3,600 a month. These are just huge numbers. But then again, if you have an expensive medication or you are in the hospital for many days, that you'll go through that in no time.
people always ask me why, how come health care is so much more expensive? How come we're spending so much more on health care than we used to? It's like, because we can do things that we didn't used to be able
Right.
to do. We have all these miraculous drugs that were big innovations, and there are patents, and the drug companies get to charge pretty much what
Right.
they want. Lots of other countries have hybrid public-private systems. We're the only country that does not limit prices on health care.
Well, Tolliver, we talked about the Affordable Care Act, a watershed moment in American healthcare when it was passed back in 2010.
Yeah, and how young and naive we all were in thinking that was the end of the story. Here's President Obama speaking after the law passed.
This law will cut costs and make coverage more affordable for families and small businesses. It's reform that begins to bring down our government's long-term structural deficit. It's reform that finally extends the opportunity to purchase coverage to the millions who currently don't have it, and includes tough new consumer protections to guarantee greater stability, security, and control for the millions who do have health insurance.
Republicans have tried to repeal Obamacare over 70 times since it was enacted, unsuccessfully so far. We'll be right back with more of your calls on The Middle. This is The Middle. I'm Jeremy Hobson. In this hour, we're asking if your healthcare is working for you. I'm joined by KFF Health News Chief Washington Correspondent Julie Rovner and California Congressman Kevin Kiley, now an independent. You can call us at 844-4MIDDLE. That's 844-464-3353. You can reach out at listentothemiddle.com. And by the way, if you don't get through, you can leave us a message and we will use it in our podcast extra, the follow-up, in the next few days. Before we get back to the phones, though, Julie, who are the most powerful voices in the debate about what to do about healthcare in this country? Is it the insurance companies? Is it the ordinary people? Is it the drug companies? Is it the doctors? Who gets heard the most?
People who make the money in healthcare do get hurt a lot, but the doctors aren't even as powerful as they used to be. The hospitals aren't as powerful as they used to be. The drug companies aren't as powerful as they used to be, but together they're all still pretty powerful. And, I was listening I was in the room when President Obama signed the Affordable Care Act. And I will say there were a number of things in that law that actually would have begun to bring down healthcare costs nationwide. And Congress got cold feet and repealed them. Almost all the taxes that were in that bill to help pay for the subsidies were subsequently repealed. Democrats and Republicans joined together to repeal things. There was a tax on medical device makers. There was a tax on prescription drugs. There was going to be a tax on very expensive, what were called Cadillac health plans. All of those have been repealed. So, I blame Congress as much as I blame sort of the big, powerful stakeholders in the healthcare debate.
Let's go to Kirsten, who's in Charlotte, North Carolina. Kirsten, what about you? Is your healthcare working for you?
No, my healthcare is definitely not working for me. I'm a small business owner, have been for over 20 years. So we've never qualified for any kind of subsidies. We always had to pay taxes on our premiums, and we are now completely underwater on our premiums, and we can't go to the doctor. It's really just a catastrophic plan. That keeps us down to $10,000 more dollars a year if something should happen.
What you said you're a small business owner. Do you have employees? Do you have to give them health coverage as well?
No, it's just us. So it's just my husband and I, and we don't qualify for anything.
Wow. So what are you going to do, or what do you want to happen?
Well, what I'd like to see happen is that, next time this gets addressed, that small businesses, those with less than 50 employees, the little mom and pops like us would actually be addressed in some kind of policy. But for now, I'm looking for a job that has health insurance.
Yeah,
I can't keep running the business. I've got to have an employer plan.
Yeah, Kirsten, thank you for that call. And Congressman Kiley, that brings up the economic consequence of this situation. Somebody who might have to shut down their business because they need another job that has health insurance.
Yeah, exactly. I mean, that's, these things have such wide ramifications. There you have a perfect example of someone who's an innovator, who's running their own business. Maybe your business could have expanded to the point that you're hiring people and creating jobs and stimulating economic growth, but because you don't have access to affordable health care, you're not able to do that. And so that's why I think that, we made similar arguments when it came to the extension of the subsidies. People, it could have perverse incentives on terms of how many hours people are working, or whether they, in order to bring themselves essentially below the line where they could qualify under the old subsidies. So all of these things do absolutely have broader ramifications. And frankly, when people don't have access to the care they need, I think that just makes them less productive in all facets of life. Like, I think the economy does best when people have that peace of mind, that assurance where they know that if something happens to them and their family, then they'll get the care they need.
Tom is calling in from Chicago. Hi, Tom. What about you? Is your health care working for you?
No, it's not working. I'm actually 75 years old and working. And if you're working, you can't use Medicare. And I was paying like $2,000 a month. The insurance went up 40% this year. And I just remember back in the 70s where Toyota started bringing cars over here. They were selling a car with no insurance versus General Motors was selling a car. Insurance was included. So there's no way that the manufacturers in this country compete, with foreign people because they've got universal health care.
I'm glad that you bring up the comparison with cars, Tom, because Julie, if you drive a car in this country, you have to be insured. But
That's right.
You don't have to have health insurance.
Well, and this was a huge debate during the Affordable Care Act, which, of course, tried to have a requirement for most people to either have insurance or pay a
penalty,
tax penalty, and which the Supreme Court did eventually uphold, although barely. But that was also repealed because it wasn't very popular. I should point out that actually you can be employed and use Medicare, but it depends, where. What works for you and whether you have employer insurance. As soon as you turn 65, you can sign up for Medicare Part A. I did. I am over 65. I am still working, and I still have employer health insurance, and I will sign up for Medicare for the rest of Medicare when I do retire, which isn't going to be for a while.
Good. No time soon, Julie. Let's go to
People keep telling me that.
No, you can retire whenever you want, but as long as you just keep coming back on the middle. Suzanne is in Littleton, New Hampshire. Suzanne, what about you? Is your healthcare working for you?
My healthcare is working for me, but what happened to me is I could see that the state was messing. I'm a retired teacher. So I could see that the state was messing with our retirement and our health insurance. So I opted to retire early. And so I ended up with a much better plan than the people that retired after me. I retired at 56. And I had to pay a penalty for retiring early. But the fact is that I have twice the health insurance than the people that followed me at regular retirement age.
Interesting. Well, and you were in the public sector, obviously, as a public school teacher as well. Kevin Kiley, I imagine that state by state, the situation for public sector workers is quite different. Is there an example, as you think about the whole country, that you say, well, they're doing it right in this place? If we just could emulate what they're doing here, it would be good.
I don't have a specific state that comes to mind. I think maybe Julie would be able to provide a better example. In a lot of states, or at least in our state in California, the system is pretty well or generous to retirees, at least in terms of the cost, and it has become this huge unfunded liability for the state. So there have been questions: how do we give our federal or our state workers the care that they're owed and that they're due, and that we absolutely cannot take away from them, but do it in a way that works kind of better within the existing system. So, even like giving them access to what the ACA gives people access to, that sort of thing. I don't know, Julie, if you have examples of states that do something like that where it works better for everyone.
It's virtually impossible for a state to do this by itself because of ERISA, the Federal Employee Retirement Income Security Act, that sort of governs benefits for all, interstate employers who are all the big employers. So we've seen a number of states try to do, their own big, state-run health system, and the only state that was able to do it ever was Hawaii, because they actually got an exemption when ERISA was passed in 1972. So that's they had an employer mandate. But we have seen Massachusetts obviously was sort of the forerunner of the Affordable Care Act. There are things that states can do around the edges, but also one of the things that the caller brings up is the sort of continuing disappearance of retiree health insurance. It used to be that employers would provide pensions and they would provide retiree health insurance too to their retirees, and that's almost entirely gone. So now people not only have to self-fund for their retirement, they have to self-fund for their health insurance after they retire, and with costs going up, it's getting harder and harder.
By the way, you mentioned Massachusetts. Just for our Gen Z listeners, it's worth noting that the governor of Massachusetts, at the time that they put in the health care plan that Obamacare was based on, was Republican Mitt Romney. It was actually called Romney Care. So it was a Republican plan to begin with. Let's go to another caller. Josh is calling in from Pittsburgh, Pennsylvania. Josh, is your health care working for you?
It's a resounding no from me, Mr. Middle.
Mr. Middle. Okay, why? What kind of health care do you have?
I have private insurance through an employer. The premium rates go up every year, so I'm making less. But somehow my co-pays are also going up every year, so I'm paying more out of pocket. The insulins I need to survive aren't covered, so the ones that work best, so I have to find a different insulin that doesn't work as well. If it's not covered, it's $700 out of pocket. If it is covered, it's still $140. You're paying that every month or two. It's just a mess.
What do you think needs to happen, especially given that you're on private insurance?
Honestly, at this point, we all know the answer, and we're dancing around it. We have to nationalize our health insurance plan, and any politician who's not pushing it is an absolute charlatan and should be voted out.
Okay. Josh, thank you for that. Well, let me ask you that, Kevin Kiley. I mean, we talked a little bit about universal health care, but also, given that 60% or so of the non-elderly population in this country is on private insurance, does the government have a role to play in fixing problems for people like Josh?
Well, sure, and I think that all various policy levers factor into many of the problems that he just brought up. Assuring just even having enough doctors out there to provide care, and nurses, the cost of prescription drugs, the role of PBMs that we talked about, the idea of having price transparency, and then I think that some of the solutions we talked about could be relevant to that as well. If you had some system of a health savings account and transparency where he could actually then go and compare the different prices to get the best value for him. So sure, I mean, all of these things are ultimately deeply rooted in policies of various kinds. And I think that, some root and branch overhaul of our healthcare system is unlikely to happen anytime soon. But there are some really targeted steps that I think we can take that have bipartisan support that I think ultimately will make things better for folks like the caller. But, it's just a matter of summoning the political will to actually do it.
Like so many other things. Let's go to Yaya, who is calling in from Houston, Texas. Yaya, what about you? Is your health insurance working?
No, it hasn't been working, and I can't imagine anybody could say yes to that question. I mean, I'm already starting to stress about my dental insurance, and I know I have a lot of friends above the age of 26, some above the age of 30, who don't even have dental insurance or haven't bothered to go to the dentist in a while. And that's just purely talking about like dental insurance. I mean, God knows the headache when it comes to general health care.
And how old are you?
Oh, I'm 25.
You're 25 years old. And so you are actually, you can't be on your parents' health insurance if you were after, I think, next year, right? Is that right, Julie? 26
Yep.
is the
26.
cutoff?
Mm-hmm.
Yeah. So what are you going to do?
I'm hoping to, have my employer's insurance or private insurance, or, truthfully, I don't like to think about that too much nowadays.
Yeah.
But the other thing that I was also thinking about was the fact that, like, nowadays I don't even think any Republicans can really put up a defense or an argument against healthcare and Medicare for all. Usually nowadays they just kind of say, like, oh, there's this Medicare fraud or this or that, which is almost always misleading or blowing what is a small thing out of proportion. Maryland, I think, I believe it was in January this year, helped a bunch of people to, get money back that their insurance, denied based, on claims and stuff. And the amount of times that, like, people have to do so much to fight these, denials of care. And it just seems like rarely do I ever see any lawmakers trying to step in and, do something about that.
Thank you very much for that call. Julie Rovner, it's true. We've heard a lot of these stories about fraud. It's come up in the political arena, but also, as he points out, you don't hear a lot of people talking about those whose claims are denied and then they have to go and really fight to get them paid for, even though they have insurance.
Oh, I think that's also a big concern. I mean, things that, we've been talking a lot this year about, prior authorization where insurers require both doctors and patients to jump through hoops to justify care, whether it's, the insurers were saying we're trying to deter people from getting care that they don't really need, but that the doctors are just going to make a profit off of. And you get the doctors saying they're denying necessary care and delaying care. I mean, Congress is engaged in healthcare just like everybody else. We're not really sure what to do. We all agree on the problem and nobody agrees on the solution.
Well, Kevin Kiley, what do you think? Will there be any action on healthcare related things between now and the midterm elections?
I hope so. There's been talk of doing this. There was a bill that passed towards the end of last year that had some modest measures in it, but it just passed the House, wasn't taken up in the Senate. Of course, I was in favor of extending the ACA subsidies in a way where we actually paid for them and had some reforms to make the program work better. So, I think it would be a huge mistake if Congress doesn't act, and I certainly am going to do everything I can to see what we can get done. I think that, again, it's probably unlikely you're going to see any massive sweeping changes like some of the callers might want to see. But I do think there's plenty that exists within the realm of political realism. Things like, let's just do a temporary extension of the subsidies. Maybe that can be paired with some sort of practical health savings account program. Let's have the transparency measures for hospitals that we discussed earlier actually really mean something. Let's make PBM reform a top priority and get that done this year. Those are things that we could do that I think have support on both sides that would make a difference and that we could do this Congress.
Julie, do you think that those things will happen before the election?
Well, PBM reform actually was in the bill that reopened the government, or at least the beginnings of PBM reform. So Congress has actually done that. And, it's going to take a while for that to sort of filter through the system. Right. I don't know what we're going to see for the rest of the year. I do know that, Republicans are talking about doing a war supplemental that could be paid for with more cuts to the Affordable Care Act, which doesn't seem like a very politically popular thing to do. That's the only thing that I really see moving at the moment. But I do think we're heading towards another major debate about healthcare. I don't think it's going to happen for another couple of years, but I'm seeing groups and members of Congress and other stakeholders sort of coming together and, sitting down and doing sort of the spade work that they had to do. It was 5 or 6 years to get ready to do the Affordable Care Act. This is going to be, we're at that point, we're at the beginning of the next debate.
That is KFF Health News Chief Washington Correspondent Julie Rovner. We've also been speaking with California Congressman Kevin Kiley, a independent. Thank you so much to both of you.
Thank you.
Thank you.
And next week, we got a special episode about the future. I'll be talking with 4 students from Harvard's Kennedy School of Government's Institute of Politics about the state of American politics and what they want to do to change it.
And we'll have more of your calls on healthcare on our podcast feed. Just subscribe to The Middle wherever you get your podcasts.
The Middle is brought to you by Long Neck Media, distributed by Illinois Public Media in Urbana, Illinois. Go Illini. and produced by Harrison Patino, Danny Alexander, Sam Burmistaz, John Barth, Johnny Leonidas, and Marina Price. Our technical director is Steve Mork. We say farewell this week to our incredible digital producer, Brandon Kondratz, who has run our YouTube live stream, redesigned our website, moved us over to Substack, and so much more. Brandon, we will miss you. Your contributions to The Middle have been invaluable. I'm Jeremy Hobson, and I will talk to you next week.